My one wish, right now I would love to find, I have a bunch of wishes, but I think right now one of the projects that I'm working on is trying to find some sort of analytics or technology that will actually map out and show us the true life of a controlled substance throughout the hospital in real time, so that we can really meet the regulatory challenges that we see today, and we can be above reproach at all times.
Oh, ideally, I think it would be great if we can just track medications in real time. I mean, what I envision, and I think I've mentioned this before, is I would love to have RFID scanners everywhere where we can dispense medication. It would be tracked in real time exactly where it is. So we would stop chasing and duplicating the work over and over again when we distribute medications to the floors. And I think that's somewhere to start. I think that will make our operation so much more efficient and give us more time to do additional activities.
Gosh, so that everyone was healthy, so we could just all go home. But I mean, realistically, predictive analytics related to inventory management and taking that forward to forecasting for our patients. So first, excellent pharmacists can help make sure that our patients are getting the right medication therapy. But the shortage issue, if we don't have the products to take care of our patients, it stifles our mission. And so the opportunity to, what I think is not just a wish, but doable, the ability to hone predictive analytics to help support our patients and make sure we have the products to take care of them is something I'd like to see in the next 12 months.
At this point, and in the time of shortages and back orders, having reliable procurement of inventory is of utmost importance.
It would be that when patients come into the hospital, they would ask for a pharmacist to make sure that their medications are safe and effective.
It would be an unlimited budget to buy all the technology I need to make my pharmacy more efficient.
Unlimited funds to obtain the best technology out there.
Well, since I'm sort of focusing on industry right now, it would be to help industry change the way they do business and actually develop a model to be more collaborative and sit down with the IDNs, learn their business, learn the different disease states and how they're taking care of patients, how they use protocols and guidelines, how they use technology. It's not just using technology, it's does all the technology that may currently be used in the hospital, or does everything interface?
So that one wish would be that clinical pharmacy, and as we expand in our clinical roles, that we're able to more accurately capture the revenue that we generate and also have a better way of capturing the cost avoidance that we provide. And by doing that, we can actually enable hospital administrators to more easily expand clinical pharmacy services.
One wish in hospital pharmacy. I would say that the one wish that I would have is for the public at large to understand better what pharmacist and pharmacy does in terms of healthcare delivery and its importance to the health and welfare of the citizens of this country and the world on a daily basis. I think we are unquestionably one of the most poorly utilized and poorly understood healthcare profession of all of the healthcare professions, yet the role that we play is so fundamentally important.
If I had one wish for hospital pharmacy, I would really like to see a large focus on continual development of pharmacy technicians and allowing them to take on new roles and really be owners of the pharmacy operations piece. With that wish, that will allow us to displace our pharmacists to focus on those clinical practice models and have them also practice at the top of their license.
To have a seat at the table, right? Pharmacy has been for too long not having that seat at the table. I think more and more healthcare organizations are recognizing the value that pharmacy brings to healthcare and to the patient experience. So we're starting to see a creep into that area, but I think we really need to expand it so that every hospital has a pharmacist at their table when decisions are being made.
One wish, sustainability. I think with ever-changing costs, increased pressures to save money and do things from perspectives that are going to help the financial system in your hospital continue to flourish. We have to find ways to be sustainable. We're traditionally looked at as clinicians who try to do cost avoidance and try to save money for hospitals, but My hope is that pharmacy can show sustainability through revenue growth, through technology and automation that drive different data solutions and different opportunities for the health system, and being at the table with high level leaders and executives to show that we can be very valuable for a healthcare system, and not only always looking at high expenses from a pharmacy budget and perspective, but also looking at ways to generate revenue and be sustainable for the health organization and be a major player in the future of changes for healthcare. So again, that's a challenge that we look forward to facing as pharmacy leaders in today's healthcare market, and that's something that I think going forward is going to be key for us.
Harmony. I really want folks who are in pharmacy right now to understand that things are changing. You cannot stand still right now. If you are not looking to change, if you are not looking to adapt, you're going to get left behind. You have to figure out right now what's important to you as a pharmacy, what's important to you as a healthcare company, and move in that direction. Don't stand back. Don't rock on your heels. Make a decision and get better.